This video will demonstrate how to complete the surgical wound assessment tool. This tool is used for monitoring surgical incisional wounds which are closed with the wound edges together. It does not replace the wound assessment integrated care pathway, which should be used for any open surgical wounds or surgical wounds which have broken down. This is the surgical wound assessment tool. It consists of only one page, on which 7 separate assessments can be documented. Post-operative wound dressing should be left in situ for at least 48 hours following surgery. This helps the incision to epithelialize and reduces the risk of infection. After this time, wound dressing should ideally be changed as infrequently as possible in order to prevent disruption to the healing tissues. 72 hours is a good period of time to leave between dressing changes in order to aid healing. The surgical wound assessment tool should be completed at each dressing change until the wound is healed. This will help identify signs of infection early in order to prompt timelier treatment. To complete the surgical wound assessment tool, you should first check if the patient has sutures or clips in place, and if so, when these need to be removed. This information can be found in the post-operative instructions documented by the surgical team in the medical notes. Complete the top box as shown. Examine the incision, surrounding tissues, levels of exudate and the type of exudate, and calculate the final score. Use the box at the bottom of the page to determine if the wound is healing or if there are signs of infection. If there are signs of infection, take a wound swab, discuss with the medical team and send a referral to the tissue viability team.